WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, thank you for tuning in. 18 minutes after 9 o'clock, we have on the phone Dr. Seth Baum. He's a cardiologist and the president of the American Society of Preventive Cardiology and the chairman of the Alliance for Patient Access Cardiovascular Disease Working Group and the president of the Partnership to Advance Cardiovascular Health. And he's also an author. We're going to find out about the book. Also, on another line, we have Mahendra Mahabir. Mahendra has a familial hypercholesterolemia. I'm sorry, I have a horrible time with some words. He had his first heart attack at the age of 17. That's maybe more important to say. He's a patient of Dr. Baum and has had firsthand experience being denied coverage by his insurance company. Oh my gosh, the denial of treatment to heart patients in Florida is what we're talking about. Dr. Seth Baum and Mahendra Mahabir. Good morning, gentlemen.
Good morning. Thank you for having us.
Good morning. Thank you.
Thank you. If you are experiencing any echo, please let me know. I think we may have fixed that problem, but if it's still happening, let me know and I'll try to adjust.
I do have echo.
You do? Okay. So that means I'm going to probably have to have only one of you on at a time, but you should be able to hear each other, okay? So let me start with you, Dr. Baum. Of all the things that we don't want, it's disease. And of all the diseases we don't want, it's heart disease. And then, of course, on top of that, we don't want to have insurance and find out that we're not covered. What's going on?
You're absolutely right, and it's kind of crazy. Heart disease still is the number one cause of death in the United States, and pharmaceutical companies have numerous medications in their pipeline and have released some of these medications, such as the PCSK9 inhibitors, the drug we're speaking about today. And these drugs have the potential to dramatically reduce heart attack, stroke, and death from cardiovascular disease. So one would think that these drugs would be made available to patients immediately, and exactly the opposite is occurring. So the payers have introduced themselves into our offices, in a sense, and they've placed themselves between the patient and the physician. And this is a terrible event, and we really need to do everything we can to stop this.
Okay, is it an exorbitantly expensive drug? Is that why they're not covering it?
It is a costly drug. We really don't know. Nobody knows how much it costs because there's a wholesale price, but we do know that there are rebates to PBMs, or pharmacy benefit managers. Most people don't recognize that there is a pharmacy benefit manager that sits between the patient and the payer. And that pharmacy benefit manager is a multi-$100 billion industry.
Really?
So, and yes, they're the middleman.
Is this a Florida problem, or is this a...
No. This is a U.S. problem. It just happens to be worse in Florida than in most other states.
Oh, okay. Mahendra, are you in Florida, Mahendra?
I am.
And tell me what happened. You were told to get this drug, and you ended up having to pay for it out of pocket?
Well, actually, with my extensive background and multiple heart attacks at age 29, I actually had open heart surgery.
Wow.
I had 5 arteries bypassed. So you would think I am a perfect candidate, and I have insurance, and the drug is one of the ones that are approved for me, but it's the steps you have to go through in order to be approved for it. Like, for instance, my Dr. Baum, prescribed this medication for me, and I was denied. Then I was denied again, and appealed, and again denied. So I believe the system is broken. I eventually was approved for it, but all the hoops, all the stress, all the aggravation, everything associated with it, it's not right, especially for a heart patient.
Oh my gosh! And where did you end up getting it from? The normal places, like a pharmacy, or did you have to go to another country?
Correct. My insurance company ended up covering for it because I have insurance to cover the medication.
Yeah.
But it's to get approved for it. Dr. Baum spent so many hours between him and his office and got so many groups involved to help me and trying to figure out how do we keep this from happening. Just about every single one of his patients are denied right off the bat. He can speak a little bit more on that, but up until I got involved and someone, the New York Times did a story on me, that's when finally something happened and I got approved, lo and behold.
Oh, really? So a little bit of media exposure helped.
Correct.
Yeah.
That's why it's so important to bring awareness to this. It's not right.
Yeah, absolutely, and hopefully this little interview will help, Doctor. Yeah, it sounds like you're doing the right thing by doing the radio tour.
Yeah, I was just about to say that it took contacting Gina Colada from the New York Times and having, I think it was a full-page article on Mr. Mahabir's plight and the plight of others to get him approved. But I will tell you, there's a second step. So when he came up for reapproval, he was denied again. Believe it or not, he was denied again. And we had to go to the FH Foundation for help. That's the Familial Hypercholesterolemia Foundation. And they're a great resource, just like the American Society for Preventive Cardiology is a great resource for doctors and patients to get the medication that the doctor prescribes.
Why are the insurance companies trying to second guess the prescriptions that the doctors are giving?
Well, that's a great question, and I think the answer is very disturbing. For some reason, the insurance companies are doing this. They are, as I said before, damaging the patient-doctor relationship, which is really sacrosanct. They should not get in the way of that. So the only thing, and I've had numerous discussions with payers. I've sat on advisory boards and had, very deep conversations with them. It all comes down to money. Okay? They say they need the oversight to make sure the physician is prescribing properly. First of all, they shouldn't have that because it's the fox guarding the hen house. But they shouldn't have that. But we've published a number of papers, and others have as well, demonstrating that this process here with the PCSK9 inhibitors is entirely flawed. So it's the insurance process. It's not the doctor's prescribing patterns.
Wow. And Mahendra, since you lost your dad and uncles and aunts to heart diseases, and they were very young also, you must have had a lot of anxiety about this when you were first diagnosed, wondering how you were going to survive.
Exactly. My story starts at a very young age. Throughout my family history, heart disease is prevalent. But my first heart attack, I was 17 years old. I was playing basketball with a few of my cousins, had chest pains, didn't know what to do. I didn't know I was having a heart attack, actually. I sat down in the shade, thought I was just overexerted, and went back and played basketball for, in about half an hour after.
Wow.
Lo and behold, in my 20s, I was 23, I actually had my first heart attack where I had a stent placed. I've, since then, every couple of years, multiple heart attacks. I've had 7 stents placed, like I said, open heart surgery, 5 arteries bypassed at the age of 29. And to answer your question, the amount of stress that I don't need, that this is putting on me, and not only me, my family, my wife, knowing there are things out there that can help me along the way and that's designed for a person like me or anyone with heart trouble to keep things that have happened to me from happening again, or at least control it. And I have insurance to pay for it, yet you have no access to it. And that's the part that's very disturbing.
Wow. Dr. Baum, I have a question about the people who might be listening who have had this exact thing happen. How are like somebody's real nice and they don't want to cause any problems. If they're told no, sometimes they won't fight back. Is that a problem? Do we have a lot of people who maybe need somebody on their side? And if so, how do they get that person?
Yep. So that is a very big problem, and particularly because the patients genuinely have the loudest voice. I've spoken to people high up in the insurance industry, and when a doctor prescribes a medication, there's no tracking of that experience. When a patient contacts the insurance company and says, "I want to be on the medicine my doctor has prescribed," the clock starts ticking. So the patient has the loudest voice. The patient must get involved. So that's one part of it. The other part of it is doctors. A lot of doctors have become burned out, don't even prescribe the medicine anymore because it's so difficult to access. It takes so much time. So the patient needs to advocate for himself or herself. And if the patient has a high risk of heart disease or has a history of heart disease or has a very high LDL cholesterol, then the patient should approach the doctor and say, "Hey, is this medicine for me?"
Yeah.
There are organizations, I'll tell you, there are organizations that can help. So the Partnership to Advance Cardiovascular Health, or PATCH, the Alliance for Patient Access, or AFPA, the American Society for Preventive Cardiology at aspconline.org, or the FH Foundation. They have great resources. One final one, the ASPC has a mobile app that will enable, a free mobile app that will enable clinicians and patients better chance of getting access to the medication. So just download that.
Okay. And before we say goodbye, advancedcardiohealth.org. Is that another website that will work?
Yes.
Okay. Dr. Seth Baum, Baum, thank you for what you're doing and for educating us about this. Mahabir, how are you feeling now?
Can't complain. I am on the medication, the PCSK9 inhibitor. I am here.
All right. Thank you, gentlemen. Thank you for both being on the air. And good luck, Mahendra. Thank you, doctor.
My pleasure. Thank you.
We'll be right back.
China leading losses after the latest tariff threat.
The Chinese ratcheting up the rhetoric over the weekend. The latest coming in a state-run editorial described the president as engaging in what they describe as a, quote, Street Fighter-style deceitful drama of extortion and intimidation.
Fox's Blake Berman, at least 98 people dead in Indonesia after a powerful quake hit the island of Lombok, and the woman millions of different strokes and Facts of Life fans remember as